My group members were Rachel and McKenna, and we chose to do our PSA on measles. So for an overview of what measles is, it's also called rubella, and is a viral infection that is spread through the airway by respiratory droplets produced by coughing or sneezing. Measles is often seen in children and was very common in the United States until a vaccine came out, which almost completely wiped the spread of measles off the country. Measles can be serious and even fatal for small children. While death rates have been falling, there is a category of children that have not been vaccinated, so still about 100,000 children get measles every year and die from it. Some causes of measles. Measles is very highly contagious, and it is a virus that replicates in the nose and throat of an infected child. When someone sneezes or coughs, the infection is spread through droplets in the airway. The infected child can pick up those droplets and spread them easily. So for a child that's playing with someone that's infected, the non-infected child will touch a surface that has the infected virus on it, or they'll touch the child that's infected, and then they'll rub their eyes or their ears, and it'll be in their body. So now for some signs and symptoms. Measles signs and symptoms appear around 10 to 14 days after exposure, and some of the common symptoms include fever, fever, dry cough, runny nose, sore throat, inflamed eyes, tiny white spots with bluish white centers on a red background that is found inside the mouth or the inner lining of the cheek, and then a skin rash that is very large and it has flat red blotches on it. Now measles and the chickenpox are very similar, but there are a few main common differences. For example, the chickenpox start with raised red bumps that turn into fluid-filled blisters or vesicles that will eventually rupture, causing a scab. And the measles appear as flat red spots that solely look like a rash. So that picture down there kind of explains the main common differences of chickenpox versus measles. Measles is more fatal and can be more deadly if it's not treated or caught right away. And then for the assessment portion, the doctors are going to start by getting a patient history just to make sure that they haven't been in contact with a child that has had measles in the last 10 to 14 days. And then the doctors will do a physical exam, which we'll talk more about for diagnosis. So with the physical exam, most doctors who are experienced can diagnose measles just off a sole physical exam. They can look at your rash and then know that it is measles. But then there are some tests that do help with the diagnosis of measles. One of them is a blood test, and the doctors will take your blood, and what they're going to look for in that test is a positive IgG antibody test, which indicates measles. They also are going to do a throat swab, which they're going to take your saliva and test it. And then in this test, they're going to look for a specific immunoglobulin M. And then same with the urine test, they're going to take your urine and a sample of it, and then they're also going to be looking for that immunoglobulin M in the body. For treatment, there is no treatment for an established measles case that can cure your virus all the way. However, there are some measures that can be taken to the affected individual. The first one is post-exposure vaccine. So for someone who has not been vaccinated and they know that they have been in contact with someone who has measles, they have up to 72 hours to get that vaccine, which will usually prevent the measles from establishing in your body. However, if it does, the symptoms are going to be milder and the infection will last for a shorter amount of time. A second treatment they can do is immune serum globin. And again, this is another shot where they inject proteins into your blood after you know you have been exposed to the virus. Instead of a 72-hour window, this one is a 6 to 8 days, so you have a little bit more time to realize if you've been in contact with someone. And then finally, some treatments for the actual measles. There's 3 medications. The first is fever reducing. This is just your typical acetaminophen or ibuprofen, which is over the counter, which can relieve the fever that comes with measles. Another one is antibiotics. So with measles, you're more than likely to establish an ear infection. So an antibiotic works to help cure your ear infection. And then finally, vitamin A. The role of vitamin A in your body is to help with your immune system function, and with measles you have a decreased immune system. So taking supplements, that's what I was going to say, supplements of vitamin A will help boost your immune system. For prognosis and follow-up, measles can be fatal if it's not caught and treated right away. Even though the death rates have been falling, it is still super important to get vaccinated so we don't see another surge of measles like we did in the 50s and 60s. If diagnosed with measles, it's important to keep in touch with your doctor to monitor the progress of the disease to make sure it's not getting worse. And then there are some lifestyle changes that will need to take place in order for you to heal the virus, such as getting plenty of rest, drinking lots of water, using a humidifier to relieve a cough or sore throat, and then protect your eyes from bright lights as measles can be light sensitive. And then for our PSA portion, prevention. Measles can be, the main prevention for measles is to get the vaccine, and I know that getting vaccines can be a really controversial topic among some families, and some people are super for them and against them, but it really is the sole way to prevent measles. So with the vaccine, the first shot will be given to infants between the ages of 12 to 15 months, and the second dose will be given between the ages of 2 to 6. And it is important to keep in mind if you're traveling with your infant that has not been vaccinated between the ages of 11 to 15 months to consult with your doctor about getting that vaccination earlier to prevent your child from picking it up in a foreign country. If someone in your house has measles, you need to take proper isolation cautions and not be in contact with them for 4 to 8 days. And then finally, you can prevent measles by promoting preserving widespread immunity, which is just making people aware of the damage that measles can do to your body. Since measles is spread through coughing and sneezing, it is important to cover your mouth when you cough. A simple cover your cough can prevent the spread. Measles was very common in the United States in the 50s and 60s before the vaccine came out, but when the vaccine came out, it almost completely wiped the spread off the United States. But again, it's still prevalent because not everybody's vaccinated. And then, so steps to overcome this issue, continuous research. So is there a way that we can prevent measles in individuals who don't want to get vaccinated? So with research, you can, I don't know if there's a pill that they can find, or just something to do that's not a vaccination that can still prevent you from getting measles. And then again, like I mentioned earlier, to overcome this issue, if you really don't want to get this disease, you have to get vaccinated, and that's the only way that you can prevent it. I got all my information from the Mayo Clinic, so if you'd like more information, you may look there.